everybody. This is Carol Maletta. Welcome to the Parenting 411 podcast, where we share information parents need from sources they can trust. I never know what I'll find at Walmart. I stumbled upon these Sofia Vergara flares at Walmart when I was making a quick run to find some party supplies. I tried them on when I got home and instantly loved the fit. They're so comfy, and they make it easy to dress up or down. Here I am out for a night of cheering my favorite ballers, the Washington Mystics. These jeans are affordable, stylish, and a great surprise find. Shop my link and grab a pair while you can. Well, I tell you, if you are anything like me, the mom of twins and boys, you've had a moment like this when your child suddenly gets hurt or sick and you're having that, do we ride this out at home or do we rush to the ER right now? Right? I know that feeling can come in quickly. So in this episode, Dr. Kailey Buller, she is a double board certified in emergency and family medicine, and she's a mom of two. She will help demystify the decision, right? So that you're not left second guessing in the middle of the night. And we're going to talk through the real life red flags and when you know that you really have got to get some help. And so you'll find out what's truly okay to treat at home. And then how to trust your instincts without letting anxiety call all the shots. So I am so glad that she's here with me. Wish I had her to talk about this when my children were younger. But welcome, Dr. Kailey Buller.
Thank you so much for having me. I'm very excited to be here. And as you mentioned, this is a very, very common problem for parents to have. I mean, babies are weird, right? They can do some strange things, especially in the newborn phase. And I didn't realize really until I had kids myself how much you second guess everything as a mother, right? So I think it's important because otherwise you're going to be that just constant baseline anxiety. Is my kid okay? So I'm really grateful that you have me here, and hopefully we can make things a bit easier.
Sure. And so I think a lot of parents really do worry about overreacting. Like they worry about taking their child there and the doctor saying, it's a simple diagnosis and this is what you're going to do. And they're going to say like, oh, wow, I had Tylenol at home, or I had an ace bandage at home. So what are some of the most common situations where you wish parents had come to the emergency room sooner rather than trying to tough it out at home?
Yeah, I think with illnesses, parents are pretty good at recognizing like my kid's really sick and I need someone else, to give me their opinion. I think that's usually pretty straightforward. But I find some of the injuries, especially the ones that don't come from trauma. So there are some injuries or very minor trauma, like a pulled elbow. And that's when, your child is stumbling, you grab them by the hand to keep them up and you can get a pulled elbow. And so their kid is refusing to use their arm all of a sudden, but there really wasn't an injury. And it's a really easy fix, but parents kind of wait it out and think, oh, they're just sore, and they wind up not coming in. And it's such an easy fix. I wish that those ones came in sooner. And there are some others like the toddler's fracture, again, really common. And there are some problems with the hip joint all the way up through, 12 years old that can happen without any injury at all. So, and we'll talk about this a little bit later in the podcast too, but if your child is suddenly not walking on one limb or they're limping, they're not using a limb when they used to, I would say that limb refusal is a reason to get checked out. You might not need to go straight to the ER, but a more urgent, like I wouldn't wait days. Right? I wouldn't say, oh, they're going to be fine. They're just sore.
Right. Wow. And I can absolutely imagine that happening, particularly if your children are involved in sports or they've been roughhousing at home playing.
Absolutely.
I could very easily see how that would be dismissed. Wow.
Absolutely.
Thank you. Thank you for that. And so now I wonder, as I mentioned at the top of the show, you are a mom of two as well. And so how did becoming a parent change the way you think about, is this really an emergency?
Yeah, I think, I mean, with most of my colleagues, with most of us, it goes either one of two ways. Either your kid gets sick and you automatically jump to the worst case scenario,
Mhm.
or you're that parent that says, "Oh, you're bleeding? Is it oozing or gushing? Okay, you're fine." Like, we just leave everything, right? I tend to fall into sort of the second category there. I
Mhm.
tend not to worry. And then I think I wind up probably leaving it a little too late myself sometimes.
Mm.
But like I said, I didn't really appreciate how much you second guess everything. I mean, when I had babies and I had all this medical training, I still was like, is this normal? Is this not normal? So it really made me appreciate a lot more what other parents are going through because they don't
Mm.
have even the medical training that I had. So everything must seem like a big
Mhm.
question, right?
Yeah. Well, tell me this. Have you been to the emergency room?
Yeah, sorry about that. You can tell I'm maybe getting over a cold myself. I have actually a few
Okay.
times.
Mm.
And most of the times my babies were totally fine.
Mm.
A couple times pneumonia.
Oh, wow.
Yeah.
Okay.
And my daughter, when she was about 15 months old, she pushed the baby gate over and went tobogganing down the stairs. And that was a scary one for me because she started vomiting immediately
Of
and was
course.
showing signs of head injury. And I was panicked, of course.
Mhm. Mhm.
And this is one, and again, we'll talk about this later, head injuries, but this is one of the ones that you don't want to miss, obviously. So we rushed her to the hospital and spent the whole day in the hospital, and she was fine, right? And most of the time they're
Mhm.
fine. And I think that's one of the things too that parents wind up going to the emergency department and they saying, well, I had Tylenol at home, right? Like you mentioned.
Mhm.
But sometimes you need to go just so that we can make sure that all you need is Tylenol, right?
Right, right.
So it becomes a bit challenging to know, did you really need the emerge? Maybe not, but was that visit justified?
Mhm.
Probably.
Right, right. And, you've spoken, a couple of times about babies and, toddlers. And
Mhm.
so what would be the, specific red flag signs that make a parent say, "We do have to
Mhm.
go right now. No matter what time it is, we're
Yeah,
going."
great question. No, and this is great, and I think this is where a lot of parents could use some clarity, especially to help with that anxiety. The easiest way to do it is the ABCs, and
Okay.
if anyone's ever taken a CPR course, they probably are familiar with this, but this is what we use in the hospital. This is what the paramedics use. It's called the primary survey. We do our ABCs,
Mhm.
and for us, of course, it's managing the ABCs, managing what's happening and fixing it. But for
Mhm.
parents, being able to recognize it is
Mhm.
probably the easiest thing. So going through your ABCs, A and B is airway and breathing.
Mhm.
That's step 1. If there's something wrong with A and B, you don't go any further. You do not pass go. You go straight to the emerge. So if your child is having trouble breathing, if they're
Mhm.
making funny noises when they breathe in, a gasping sound, that's stridor, we
Right.
don't like stridor. So we want you to come to the ER because that could be an impending airway loss. And if
Mhm.
they're wheezing when they're breathing out, anything like that, I think that's a trip to the ER because kids can compensate for so long. They look great, they're acting normally, and then suddenly they crash. So if they're
Mm.
having troubles breathing, please go. And respiratory illness is probably the most common reason that we'll see kids, require ICU stays or need to be hospitalized.
Mm.
So that's step 1. That's A and B. C is circulation. So if your child is so unwell that they're not eating and drinking enough,
Okay.
in younger babies, it might be not having a wet diaper for 12 hours,
Okay.
or they look mottled or pale, or their lips are dry. Like if you think that they're not hydrated,
Right.
again, they look good until they don't. So if they're starting to look dehydrated, I would go to the ER.
Okay. Okay.
And then, yeah, so that's ABCs. D is disability, and that's the neurologic piece. This is the trickier one to sort of get a handle on. But what I normally tell parents is if they're not behaving themselves, if they're not acting normally, so in a
Mhm.
baby, that
Yeah.
might be inconsolable crying. You
Mhm.
cannot settle them. I think that's a trip to the ER because that can be some scary things. And if you don't know, that's my job. I'm supposed to know. So you bring them to me and I will tell you if they're okay
Mhm.
or if they've had a head injury, or even if they haven't had a head injury, if they're just not acting themselves. If
Mhm.
something's wrong, your
Mhm.
spidey senses are tingling, I would go because it's better safe than sorry. So those are the ABCDs.
ABCDs. Okay,
Mhm.
thank you. And actually, I had taken CPR a long time ago when my children
Okay.
were younger. I did that, and I had that was a refresher for me.
Yeah.
So I will try to hold on to that down, years ahead when my children my children have children, and
Well,
I'm
absolutely.
watching the grandchildren. I'll have to remember that. Oh,
Remember your
actually,
ABCs.
honestly, I'll probably
Yeah.
take the course again. It's
And
very
I
important.
think every caregiver should. It
Yeah.
just to help so that you know that you have some background knowledge there that will kick in in
Sure.
case there's any trouble, right? And the ABCs are nice because it's easy to you don't want something hard to remember when you're in a high stress environment. So just remember your
Yes.
ABCs, right?
Yes. And so, on the flip side, what are some illnesses or injuries in the first year that might seem really scary, but it can be managed at home?
Absolutely. I think viral illnesses fall into this category a lot. Like kids can look really miserable. They can be really uncomfortable. They can have fevers. They can feel really awful.
Mhm.
But as you had mentioned, there's not much that we can do necessarily except what we call supportive care or treating their symptoms. So that might
Mhm.
be Advil, that might be Tylenol, it might be doing saline sinus rinses or advising you to do saline sinus rinses. And those are things that you can do at home. So
Mhm.
unless they have any of those ABCDs,
Mhm.
you can probably keep them at home and keep a close eye on them. The only caveat to that is with fevers. Now, a
Mhm.
fever technically is 100.4. So
Mhm.
anything less than 100.4, a low grade fever, I wouldn't count that as a fever in terms of going to the hospital. It is technically low grade, but the chances of that being something that is treatable, something that we can give antibiotics for or do something about is still pretty low. So 100.4 is the cutoff.
Okay, and then two, some of the signs that we're talking about that something could be managed at home, even if they don't come to the emergency room, maybe they could call their
Absolutely.
pediatrician instead, you know.
Absolutely. Yeah. And I
So,
think for things like delayed fevers, recurring fevers, fevers that last 5 days or longer, those are great pediatrician visits because you
right.
want to be seen,
Mm-hmm.
certainly, but you don't necessarily have to rush to the ER. The only caveat is a fever in a child who's 60 days or younger. Any
Okay.
fever for no matter the reason, 60 days and younger, you go to the ER because we need to rule out an occult bacterial infection or a hidden bacterial infection.
Okay.
And if they're under a year old and you don't know why, they have no other symptoms, they've got a fever and
Mm-hmm.
nothing else, you go to
Yeah.
the ER because we need to rule out the sinister things like meningitis. Meningitis is the big one that we're always constantly trying to rule out, and that one can be really sneaky. So the
Mm-hmm.
signs of meningitis are a lot of our ABCDs, right?
Mm-hmm.
Lethargy, not behaving themselves, seizures,
Okay.
obviously that's pretty obvious. But fevers without any other cause, that could be meningitis. So that's the reason why I say fever no cause. You should be seen in the ER just so that we can take a look and maybe
Wow.
we send you home with Tylenol, right? Like maybe it's a big waste of time, but we do need to rule it out.
And meningitis, that's very serious, I tell
Very
you. So
serious.
I'm glad you pointed that out, and
Mhm.
that a high fever with no other
Mhm.
cause is a huge red flag for that.
Mhm.
Yeah, that's
Big time.
very serious.
Mom, you know that helpless feeling when your little one's cough just won't quit? Well, Children's Mucinex for cough and chest congestion is here to help. It's got just the right ingredients to gently break up that mucus and calm chest congestion. It also thins and loosens mucus so that you can quiet that nagging cough and your child can rest well. Plus, it comes in kid-friendly flavors like berry berry and orange cream, so getting relief is actually easy. Use this link to grab yours at Walgreens so you are ready for cold and flu season. Just click the link below and snag this deal today.
Yeah.
So I would say too, another thing that parents worry about a lot, and I know that I expected to go to the emergency room a lot, especially with two boys and twins, partners in mischief.
Absolutely.
I thought I would make a lot of trips to the emergency room because I think I told you before, I went to the emergency room a lot. I was always doing something. And then I also have a nut allergy. So
Oh, yes.
before we realized that I had the nut allergy as a child, we made a couple of trips just for that
Mhm.
until that was diagnosed, and then we were fine.
Mhm.
So a big fear though is, like injuries, right? And
Yeah.
so what are the big differences between let's wait and see,
Yeah.
for a bump or a cut, or and what kind of head injury or burn or broken bone really requires emergency care?
Really good question. So, I mean, we'll start with lacerations because I think is the easiest. The only time that you truly need to rush the ER is if you can't control the bleeding, right? So,
Okay,
if it's a
okay,
big cut, you can't control the bleeding, you got to get to the emerge. Obviously, that's a C problem. That's a circulation problem,
okay,
and that's you need to get there quickly.
okay.
If you can control the bleeding, and this is something that's really interesting that I think a lot of people don't know, is if that cut is bigger than a grain of rice, it's as long, as deep, and as wide as a grain of rice, it probably would benefit from being stitched closed or glued closed.
Okay, got it.
Yeah, so that's not very big. And especially in kids, even something smaller on the face or on the lip, we would potentially glue or stitch that as well. It's not an emergency per se. The
Mm-hmm.
infection risk increases after 24 hours. So if you can see your pediatrician or urgent care within 24 hours, that's totally acceptable. But if that's
Mm-hmm.
not available to you, then that also becomes an emergency room visit just so that we can stitch it closed in the 24-hour time frame.
Mm.
So,
Wow.
mhm. Yeah.
And I'm thinking about when I was in second grade, I was riding my bike and down a well, actually I was riding a neighbor's bike because my bike had been stolen overnight. I left it outside.
Mm,
And so I was riding a neighbor's bike. Of course, it wasn't my bike, so it didn't operate the way what I was used to. And so I was riding down, and all of a sudden, the front wheel started jiggling, and it wasn't stable, and I just flipped over the handlebars,
oh,
and
jeez.
yes, and thank goodness that was a Saturday morning. All the dads were out mowing their lawns and all of
Right.
that, and so we lived all the way down the hill. So one of the dads up the hill, went down and alerted my father, and then I went to the hospital. I think I was in the hospital. It probably was overnight, but as a kid, it probably felt like a couple of days or whatever. But
Mhm.
yeah, they definitely kept me there, and I remember I couldn't go to sleep. Like I kept wanting to go to sleep, and my my
Yeah.
father was keeping me because my mother wasn't home actually, and
Mhm.
so that was my emergency stay where I actually had to
Yeah.
stay. There were other times I had to go, but wow, this conversation is triggering those
I'm
memories.
sorry. I'm bringing
Oh no,
back
that's okay.
PTSD. But yes, no, but you're absolutely right. So that's it. That's it. That has changed since your hospital visit, which I do very much appreciate about concussion protocol. We
Okay.
do now let kids sleep. We let everyone sleep. So that's a
Oh,
big change. Your brain needs rest after a head injury, so sleeping is okay. You don't
okay.
have to keep them awake. You don't have to wake them up for neuro checks. You can let them sleep. I do tell a lot of my parents if you're worried, because I was worried when my
Mhm.
kid had her head injury, you can go in and you can sort of rouse them slightly. Don't wake them up, but sort of give them a little shove and see if they go ugh and roll over, then they're fine, right? As long as they still are moving and responsive. But
Yeah.
that's a nice thing now. I think that you can let your tired, brain injured kid get some sleep.
Well, yeah. No, I'm actually recalling, like, in the car, he wouldn't like, on the way to the hospital, he's like, "No, you can't
Mhm,
sit
mhm.
up." He's like, "No, you
Yeah,
can't go to
yeah,
sleep." But
yeah.
now I know you have a, green, yellow, black system when you think
Mhm.
about severity.
I
And so,
do.
can you walk us through what the colors mean and what it might look like in, real life baby or toddler, young child, scenarios so parents know when to stay home and when
Mhm.
to run and
Right,
not walk
right.
to the
Yes,
ER.
absolutely. Yeah, no, absolutely. So for those of you who might not know, I did write a book. It's called Surviving Tiny Humans, which I think is very apt because you have to survive and so do they, and they're little sort of death and dismemberment magnets. I'm sure your twin boys were.
Uh-huh.
I have a whole chapter dedicated to knowing when to seek care and when you can stay home. And green basically means you're in the clear, you can stay home. A lot of these are common baby rashes. Some of them look really scary, but there's common
Mm.
baby rashes. You don't even have to worry about them. You don't have to think about it. So I've got these color photographs and say, don't worry about this rash. Perfect.
Okay.
And then there's some viruses. So oftentimes a cough and cold is a category green. You can keep them home. You can give them Tylenol. You can give them Advil. You can do sinus rinses. You can do steam. Just try to keep them comfortable. And of course, you're always watching for those category black symptoms, which are the ABCs.
Right.
And then there
Okay.
are a few other category black injuries that I talk about. Yellow is stay home, but keep a close eye on them. So
Okay.
something like hand, foot, and mouth, for example, keep them home. But if they stop eating and drinking, if they're
Mhm.
not able to do anything because their mouth hurts so much and they become dehydrated, which is category black, then you're going to need to go to the emergency department,
Mhm.
right? So there
Mhm.
are some that can get worse
Mm.
relatively quickly, and those are the ones that I highlighted as category yellow. Category red, those are the ones that you're probably going to want to book in to your you're probably going to want to book into your pediatrician or to
Okay.
your family doctor. Here in Canada, we don't usually have primary care peds. Um,
Oh, okay.
yeah, or urgent care. And
Mhm.
we want to be seen within sort of 24 to 48 hours, right? So that
Mhm.
would be your delayed fevers. So you've been
Mhm.
sick for a few days and then you get a fever. That's probably an ear infection, to be honest, right? You've had the
Okay.
cold, you've had the congestion, now your ears become infected, and now you have a fever. So it's not an emergency, but you're going to want to be seen within a couple
Right.
of days, probably to get that treated.
Right.
And the recurring fever is the one that are like on and off and on and off. That
Mhm.
could be something like a walking pneumonia. We've been seeing that a ton the last 2 years. I really didn't see it much before, but the walking pneumonias where kids are relatively okay or they're good for a day, then bad for a day, then good for a day. That could
Hmm.
be something like that. Yeah. So you could see your pediatrician for that or come to the emerge if that's not available, of course.
Wow, this just is reminding me that it's been so long since I've had to
Yeah.
really think about that and really look at my child and just try
Hmm.
to figure this stuff out. Like when you said, I remember when hand, foot, and mouth disease was going around
Hmm.
in our neighborhood. My children never ended up with it, thank goodness.
Oh,
But
thank goodness.
yeah, they escaped that.
We've
So
avoided it so far, but I don't know. We might still get it. My kids are only 6 and 3, so there's still time.
oh goodness,
Yeah.
yes, yes. So, when your child is suddenly very sick and you're just panicking,
Mm.
what kinds of things can parents do before a crisis happens so that they can just feel confident about making decisions when the time comes? Because
Yeah.
like you said earlier, you don't want to be in the moment. Like, what was
Right.
that again?
Yes.
A, B, C,
Exactly,
D.
exactly. So, I mean, I do like you mentioned, I do recommend that everyone take, a child CPR course, especially in the early days when you're gonna be starting solids. You wanna know what to do when your child starts choking, right? Just simple things like that. But when it comes to preparing yourself, that's hard to do because, like you said, you're not gonna you don't have 10 years of medical education. You're not gonna remember all of this. And you're gonna maybe read it once, and then 2 years later, when your child does get sick, you won't remember.
Mhm.
So I did create actually a flow chart, a decision chart that you can print out and put on your fridge. It has all of the category black symptoms, which are the ABCs at
Wow.
the top. Go to
Okay.
emerge, do not pass go, do not collect $200, off you go, right? And then it says, okay, we've ruled out all of those. What's next? Fever. Are they less than 60 days old? Go to the emerge. Are they fever and you don't know why? Go to the emerge. If not, stay at home. And so it's just one page and you can just stick it there for reference. And then I also have a one page ER worthy issues so that you
Mhm.
know what you're looking for. And again, you can print that out, maybe put it with your medicine cabinet or just somewhere that you can reference it easily so that when you are in a scenario and you don't know what to do, it's a quick flow chart that you can work through in 10 seconds and then you
Okay.
could figure that out. So I'll send you certainly the link for that, and any of your listeners who are interested can download that.
Oh, I think a lot of folks are gonna wanna learn more about that. Thank you so much for
Oh, of
that.
course. Yeah.
And so, if listeners remember nothing else from our conversation, what are the
Mhm.
top 3 never ignore this
Mhm.
symptoms that should always trigger an immediate trip to the emergency room for a baby or a young child? We've talked about a lot of this, but if you wanted to drive it home and
Yep.
double down on it again, what would that
Absolutely.
be?
It would be trouble breathing,
Okay.
being dehydrated, which is harder to measure, but you'll know,
Mhm.
and a change in behavior. Lethargy being the biggest one. If
Mhm.
they're so drowsy, you're having a hard time waking them up, you need to get to the ER. And for a baby, inconsolable crying. Those are the three things: change in behavior, shortness of breath, and dehydration.
Okay. Okay. And is there anything else you want to share that we didn't talk about?
I think the only other thing would be, I mean, as you mentioned, head injuries are tough. If they have any of the change in behavior things, you want to
Mhm.
go. But I do want to point out that a fall of greater than 3 feet or a major injury, so falling off your bicycle, being in a car accident, if you've hit your head, even if your child is completely symptom-free, that's one of those scenarios where we want them to be observed. And they don't necessarily need to be observed in the ER. If you can go to the urgent care, that works too. But we just need someone who knows when to make that call. Yes, they can go home, or no, I think they need a CT head. We want them to be monitored usually for about 4 hours. So a major fall, even if they're totally fine, that's another reason to go. And that's the only really tricky one.
Okay.
Yeah.
Okay. Well, thank you so much, Dr. Kailey. And as we wrap this conversation up, parents, I want you to remember that the goal is we're not trying to turn you into a doctor here. By all means, if you're unsure, you seek out the support. But we just want to help you feel a little bit more comfortable and a little bit more steady when you have those scary moments at home. And if this episode helped you feel more confident about caring for your tiny humans, don't do this journey alone. Come join us in the Parenting 411 community on Facebook and just search Parenting 411 community on Facebook.com. Dr. Kailey, tell us how we can follow you as well.
Absolutely. If you just remember Vitals with Dr. Buller, Buller, Vitals with Dr. Buller, that is my social media, my website. You could find me and everything that you need.
Okay, that sounds great. And so you have Dr. Buller, and you can also join the Parenting 411 community on Facebook and just request to join so that you can connect with parents, share your questions, and keep getting the support and encouragement you deserve. And I have to tell you, I'm thinking about maybe even asking Dr. Buller to come back and speak, just especially to our community. So we'll talk about that. But listen,
Absolutely.
I can't wait to see you. Oh, thank you. I can't wait to see you all in the community. And in the meantime, remember, it is never too late to be the parent you want to be. Thanks again. And I can't wait to talk to you again next time.
We bring you this episode for the purpose of information and entertainment only. It is not the intent or purpose of the Parenting 411 podcast or Carol Maletta to provide an exhaustive reference or guide on all aspects of parenting, childcare, and family life. You are strongly encouraged to read all available information, consult medical or other appropriate professionals, and pursue all reasonable means to learn as much as possible about parenting to complement what you gain here, and then tailor the information to meet your individual needs. Yes, parenting is a serious matter, though it is not an exact science. The context and insights offered in this and every episode represent an account of knowledge and personal experiences of the host and any featured guests for the viewers and listeners' information and consideration. The host and guests do not guarantee to our viewers or listeners any specific parenting outcomes from this episode or taking actions described here.